I know we don't want to talk about it. We don't want to think about it. But burying our heads in the sand gets us absolutely nowhere. So when it comes to COVID, let's just get the information so we can make decisions accordingly. The reality is public health officials say the number of infections is climbing again. Masks are becoming mandatory in many healthcare settings again. Health Canada recently approved an updated MRNA COVID-19 vaccine. It's from Moderna that targets this new Omicron subvariant that is circulating now. So where does this leave us as far as vaccines go? Should you get another COVID shot or not? We always turn to Dr. Christopher Labos for these kinds of questions. He's a cardiologist with a degree in epidemiology. You can hear him at 8:10 on Sunday mornings right here on CJAD on Weekends with Ken. Thank you so much for your time again, Dr. Labos.
Oh, my pleasure.
So surely I'm not the only one having deja vu here. Do you feel like we've had this conversation many, many times already?
It does seem like we've had. And the unfortunate reality is that we're having it is because we keep getting back into a same cycle. COVID is having a roughly seasonal fluctuation, very similar to what we see with the flu and RSV. Not completely identical. There are some irregularities to it, but, cases tend to be lower in the summer and higher during the fall and winter. And, despite the fact that it's a pretty sunny day today, we are getting into fall. And with school starting, with the weather getting colder, we are going to see more infections and things are going to get worse again. We don't know how bad. We don't know if it's going to be as bad as last year. But there's a very real potential that you could get exposed to COVID or influenza or RSV, and protecting yourself against all three of these things is going to be important. And this is likely going to have to be a conversation that we have every fall and winter because it doesn't look as if COVID or the other viruses are going anywhere anytime soon. Not going anywhere, but maybe our ability to deal with them is better. I'm just thinking anecdotally, Dr. Labos, yes, more people I keep hearing are getting it again, although they don't seem to be falling as ill. I don't want to make it sound like I'm dismissive about it, but I think there's an even larger number of people who probably aren't even getting tested or worrying about it at all. Right. And the other thing to bear in mind is that a lot of the most vulnerable people died already. I mean, there is a bit of survivalship bias going on here, which is that when you remove the highest risk people from a population, everybody who's left over appears to be at lower risk. But that's sort of a bit of a statistical artifact. And again, we always default back to our own personal experience. You're like, well, I'm fine. Everybody around me is fine. Why should I worry about this? It's hard to conceptualize the difference between the risk to you as an individual and the risk to society as a whole. And that's a very hard and sometimes subtle argument to make because people will be like, well, I'll be fine. I might get a little bit sick, but I'll likely survive it. And you're like, yes, you probably will survive it. That's true. But one, keep in mind, you don't know what the long-term disability is going to be like. And there's a not insubstantial number of people who have long-term debilitating symptoms from COVID that can last weeks to months and sometimes forever. And you definitely want to be vaccinated to try to minimize the risk of that happening. But you also have to think about the implications to the healthcare system as a whole. And when a healthcare system is struggling, yes, you might be okay. But if you have the option, don't choose the option that makes you wait in an emergency room for 15 hours waiting to get seen, because that's kind of what the reality of the healthcare system is right now. And yet I think to myself, even someone like I'm fully vaccinated. I'm a big believer in vaccination. And yet I find myself not wanting to think about it. I don't want to get another. Well, now listen, we had it in May, so I know we can't get it anyway until towards the end of November because it's 6 months still. That still stands, Dr. Labos? Yeah, that's pretty much it. I mean, because if you get it at a shorter interval than that, you're not going to derive very much benefit from it. Now, we have to pick a threshold. I'm sure at 5 months, it probably would still be okay. But just for the sake of, simplicity, we tend to have a 6-month interval. And the point is this, you don't want to, if you get it too soon, you're not going to generate antibodies because you still have the antibodies circulating from the prior vaccination or the prior infection if you got infected recently. But the point I'm really trying to make there is that I feel like even someone like me who's predisposed to be like, yeah, okay, I'm going to go get the vaccine. I'm like, I've kind of had it. And yet I know that it's still out there. What do we need to know about this new vaccine? And what do we need to know about this new Omicron subvariant? Well, the vaccine is basically a different vaccine from what you got previously. So in the same way that there's a different flu vaccine every year, it looks as if there's going to be a different COVID vaccine every year matched to whatever circulating variants are out there. Because in the same way that there's a different flu virus every year, it's like, well, we're probably going to be dealing with different variants every year. So the vaccines that are going to be rolled out now, presumably some point in October, we don't know exactly when, they were specifically formulated against the XBB 1.5 variant. So that was the variant that was circulating in the summer. And so that was the best prediction that could be made at the time. You've had other variants sort of creep into the picture, EG5 and BA2.86. And while these names and numbers letters and numbers may not mean very much to many people, these are all Omicron subvariants, and they are similar enough that it appears that the vaccine that you're going to get in October is going to give you good coverage against all the circulating strains out there. So it's a better match to what came before, and that's likely going to be the strategy moving forward, which is developing a new vaccine every year to better match the strains that are circulating out there in the community.
I'm going to ask you another question that I know you've answered before, but what about flu, seasonal flu, and RSV going around at the same time? Should we be trying to get vaccinated against all of them?
Yeah, so the flu vaccine is going to be available to everybody. It wasn't always the case. Before COVID, Quebec was actually the only province where the flu vaccine was not universally available to everybody. It was only covered if you were over the age of 65 or had underlying health problems. So now the flu vaccine is going to be available for everybody. The RSV vaccine, the new one that has just been developed, is only available for people over the age of 60. That's how it was approved by Health Canada, because that's how the original studies were done. And so you have to remember is that all of these viruses out there can make you sick. And the older you are and the higher risk you are, the more benefit you're going to derive from this vaccine. People come to me in the last bill, well, I'm young and healthy. Do I really benefit? And you're like, listen, benefit and risk do not exist on a dichotomous scale. You're not either, at risk or completely safe. It's risk-based, and so it's continuous. And so the older you are, the higher risk you are, the more important this becomes. And so you have to look at your risk profile and say, how much risk am I and how much illness am I prepared to accept? And for most people, frankly, you don't want to get the flu, you don't want to get COVID, you don't want to get any of these things because just influenza kills thousands of Canadians every year. COVID is, worse than that. And you don't want to get sick, even if you survive it. Having to take a week off work and to be sick in bed, that is not going to be pleasant for people. And so if you get vaccinated, you will, on average, have a less severe infection, a lesser risk of long COVID, and probably lesser long-term complications of all of these diseases. And this is not something to be taken lightly.
Thank you, Dr. Labos. So appreciate your time as always.
My pleasure. You take care.
You too. That is Dr. Christopher Labos, a cardiologist with a degree in epidemiology. You can catch him Sunday mornings here on CJAD 800 with Ken at 8:10.